Welcome everyone to a brand new webinar with cosmetic laser dermatology. Today we are here to learn about our proprietary treatment, ThermiSculpt³, one of our most requested treatment combinations. Dr. Douglas Wu is going to give us all a breakdown of this non-surgical combination treatment, how it can dramatically reshape and tighten your neck and jawline in just one session, as well as enhancing this treatment with biostimulators, neuromodulators, and laser treatments to address multiple signs of aging simultaneously. For those who don't know Dr. Wu, he is a double board certified dermatologist practicing in San Diego and his practice in Vancouver, Canada. While Dr. Wu will be speaking about ThermiSculpt³ today, he also does laser treatments, injectables, sclerotherapy, tattoo removal, and all types of aesthetic work, as do all of the other providers at Cosmetic Laser Dermatology. And without further ado, take it away, Dr. Wu.
Great. Thank you very much. Good to be here. All right. So I guess we'll talk a little bit about how to rejuvenate kind of the neck and jawline, and with a focus on one of our proprietary new combination treatments that we've been doing. Actually, I mean, it's not super new, but we've been doing it for many years, and we've kind of developed it in a way that nowadays it's really quite a nice procedure for this purpose. So um, the chin and jawline is probably one of the most common areas that we look at aesthetically, and it forms one of the most often sought after types of treatments because having a snatched or tight jawline tends to be a really desirable feature. And we can see this in just regular media and all over the place. It almost is always a defining element of aesthetics, no matter what race or skin type that we're looking at. And basically, there are three main features that we want in a quote unquote perfect jawline. We tend to want it to have definition, okay, which means that there's a clear separation between the face and the neck. We want it to have a certain contour, okay, which shape and size, as well as the strength of the jaw and the sort of neckline. All these are customizable and somewhat sort of personal preference, but in general, there is a certain contour that most individuals want and most of the times looks the best. And then finally, just simplicity. Okay, we want a single, smooth, sort of unbroken sweep from chin up to the jawline, rather than having a wavy contour or things sort of obscuring that simplicity. So those are the kind of features that we look for in the chin and jawline, and we've developed a number of treatment options in order to promote that sort of aesthetic in a non-invasive or minimally invasive way. And so there's an option for anyone really, if this is something that bothers you and it's something that you want to address. So basically, the skin changes and ages over time in very predictable ways. Okay, we get, especially in the neck and jawline, we tend to develop a little bit of looseness to the skin, something we call skin laxity. And the reason we get that is because the structure of the skin, like the collagen and the elastic fibers, these sorts of things start to just naturally degrade over time due to genetics and sun exposure and other things. Also, the neck and especially the area just underneath the chin is very prone to sort of accumulation of a little bit of excess fatty tissue. Okay, and sometimes this results in a little bit of a double chin appearance or a blunting of the jawline, and a reduction of that smooth aesthetic contour that we want. And these two features, the skin laxity and the excess submental tissue, sort of happen simultaneously in many cases. And so strategies to target them are very valuable. Um, and this is an illustration, for example, in this individual here. There's nothing wrong with the neck or jawline, but certainly over time and age and the years, there has been a little bit of increase in the looseness in the skin. We can see that the jawline, instead of a straight sort of smooth curve, it's a little bit interrupted by a little bit of jowl contour. And there's some fine lines developing kind of in the neck region and a little bit of looseness to the skin, especially in the central neck, and then a little bit of excess fatty tissue just underneath the chin, causing typical double chin sort of contour. And so this is very common sort of presentation. And sometimes we get excess fatty tissue that is not really accompanied by skin laxity, especially maybe in younger individuals. And this is an example of that, for example, where it's mainly just sort of excess fatty tissue, which is not really associated with laxity. And sometimes we have both. Okay. where there's some significant skin laxity, as well as perhaps some excess fatty tissue that can both be addressed. And then, the skin surface quality as well, including any lesions that might be in the area, moles or other age spots, et cetera, can also be addressed. Um, so when we talk about something like ThermiSculpt³, okay, this is an advanced technique where we combine multiple different treatment modalities into a single treatment session in order to essentially target every single aspect of the issue that is contributing to the problem. And this is different patient to patient. And so the combination of treatments and the selection of these treatments may be different from patient to patient. But they could involve things like the Thermi procedure itself with a little bit of microliposculpture and or some laser and or some injectable treatments mixed into the match as well. And so it's really a very customized treatment that depends very heavily on a very close and thorough examination that we do in the office as part of the consultation, where we can assess all these features and make sure that the treatment is perfect for every individual that comes into our office. So in general, we have the skin tightening options, okay, and these are like energy-based options or laser-based options. There's some ultrasounds and radio frequencies, and then there are fat reduction options, okay, which include things like non-invasive injection treatments, non-invasive device-based treatments, like cool sculpting, for example, as well as the arguably the most effective method, which is a minimally invasive procedure called ThermiSculpt. And so when we talk about skin tightening, okay, we're generally speaking about energy-based devices like ultrasound technologies and radio frequency technologies that can deliver energy into the skin and therefore stimulate new collagen growth that ultimately achieves a lifting and tightening of the skin that is treated, in this case, the neck and the jawline. And there are three actually technologies that we commonly employ for this purpose. One is called therapy, which is on the screen right now. The other one is called thermage, which is a radio frequency technology. And the third one is called softwave, which is also an ultrasound technology. So the ultrasound technologies basically work in a similar way, whereby the ultrasound energy is focused kind of deep beneath the skin, okay? And a controlled amount of heat is delivered to this layer. And that eventually develops into new collagen growth because of the stimulation, and that new collagen helps to tighten and lift the skin. On the other hand, when we use radio frequencies, the energy is basically developed in bulk, and the entire area is heated up with the radio frequency energy so that we essentially get a global improvement in skin quality as well as skin tightness. Okay, and thermage is the classic example of that. It's been around for many years and still a very effective treatment. We actually have done many comparative studies, looking at these types of technologies. And essentially, the bottom line is that they have to be done correctly. And there are some advanced techniques that come into play beyond the standard sort of recommendations that sort of come in the guidebook. And tuning these sort of techniques to each individual patient tends to be the most important way to get the optimal results from any of these treatments. And as you can see here, one thing that's important to understand about these treatments is that they are non-invasive, okay? And so we're not necessarily comparing them to a full surgical approach, which may include a neck and a facelift or something of that nature. We're more targeting individuals who either are not candidates for these surgical procedures or don't want the surgical procedure for whatever reason, either downtime, scarring, risk, etc. And for individuals who have developing skin laxity, but it's not to the extreme degree that maybe requires some sort of surgery. Okay, if we can capture skin laxity at its earlier stages, then we can actually do these treatments not only as enhancement and improvement and correction of the issue, but also as prevention of continued skin laxity over time. And so this is a very realistic sort of expectation from something like an ultrasound-based skin tightening procedure. And when we compare them across sort of different technologies and different modalities, like I said, as long as they're done correctly with the right techniques, then the results tend to be quite similar across the board. Okay, so when we talk about skin laxity, that only kind of covers one aspect of the issue for some patients, and the other aspect often is sort of fat reduction and true sculpting of the jawline. Okay, and so it's not just necessarily reduction of fat, but also sometimes even building of additional structure with injectable treatments to the chin and to the jawline area. And so for this type of thing, and like for any uh, procedure that we do, it's very important that we understand sort of the anatomy of the situation and the science that goes behind these treatments. Because once we have a deeper understanding of those two issues, we can then sort of apply more advanced techniques and customize to a much greater degree for each individual person. Because our anatomy is very different, or potentially there are some variations between each individual person's anatomy, and those have to be taken into account. But to simplify, this is a complex, medical school type version, but to simplify it, we basically have like one muscle that covers our neck. It's called the platysma. Okay. And beneath that platysma, we have this sort of fatty pocket. Okay. And it exists in everybody, and in some individuals, just due to genetic reasons, it's a little bit accentuated, and things like weight gain and weight loss can also cause fluctuation. Basically, we target this submental region and also the jowl fat region with our technologies in order to sculpt and or reduce and or change it in some way so that it is tighter and better in terms of its aesthetics. And when we talk about the anatomy, it's just you can see just by looking at this picture, there's a lot of different structures that are very important to respect in this vicinity. And so for operating in this area, for any reason whatsoever, it's actually imperative that we understand all of what's going on here so that we can do everything safely and effectively. And it turns out that luckily, if things are done properly, this is an extremely safe area to treat with the techniques that I'm describing in this presentation. So it's kind of self-explanatory. There's just a lot going on here, and the actual names of these anatomies are not important for your purposes, but this is just a look at what we think of when we look at this area and when we're treating each individual patient. So we'll start with maybe a description of some of the non-invasive approaches. Things like cool sculpting, for example, targets the fat in that area. It's got a little applicator that sort of attaches directly to that area. And sometimes, in the right situations, we can get some reasonably good results just with cool sculpting itself. This is a completely non-invasive treatment, and it primarily does fat reduction, okay, to a certain extent. It's not miraculous because it is completely non-invasive, okay, but it can, for the right individual, give some pleasing results. There is another injection treatment that we don't do too much of these days, but essentially it's an injection of an agent that can target the fat and also help to dissolve it essentially over time. And there are some benefits to this type of approach as well. In terms of minimally invasive approaches, this is where we start talking about the actual ThermiSculpt³ procedure. And it is ideal for individuals who have both a combination of excess fatty tissue as well as some skin laxity. In this situation, this fellow mainly has some, excess fatty tissue in the area, and so skin tightening is a secondary importance for him. And in this kind of situation, we could simply use our microliposculpture technique, okay, to remove that little pocket of fatty tissue and sculpt the jawline. As you can see here, although there's some facial hair in the after photo, there's still an appreciable sharpening of the jawline and a reduction of that submental area. And it's it's interesting to see how just treatment of that area alone can fairly dramatically improve and or change the entire overall impression of appearance aesthetically that we have of an individual, even though other areas may not have even been treated. So that kind of underscores the importance of the neck and the jawline and the chin area for overall aesthetics of the face. This is the Thermi procedure or the Thermi device. It's basically a monopolar radio frequency that is very clever because it combines this temperature controlled delivery method whereby a very precise amount of radio frequency energy is delivered and an exact and real-time temperature measurement is taken both underneath the skin where the radio frequency probe is situated, as well as externally via an infrared camera that measures in real time the temperature of the surface skin. And these two factors are very important because we want a very precise energy to be delivered underneath the skin. Okay, and it has to be at a fairly high level in order to achieve some sort of result. But we also want the surface of the skin to be safe from excessively high temperatures. And so monitoring with this infrared camera at all times is extremely important. And there have been some updates to this technology. It's been made safer, it's been faster, more powerful, and better. But to illustrate as a schematic, okay, this is basically a cartoon of the skin. Okay, and I created this in PowerPoint, so I apologize if it's not super great. But basically, we have the top layer of the skin, it's called the epidermis. Then underneath that, we have the second layer of skin called the dermis. And then finally, beneath that, there's a layer of subcutaneous tissue, which we call the subcutaneous fat. The Thermi procedure uses a little probe that we insert into the skin via a tiny little puncture site that heals up with no scar. And we insert it so that we target this subcutaneous fat layer, but at the junction that it resides with the dermal layer. Okay, because the dermis is where we have our collagen, and that's where we want to stimulate new collagen. And so we target that interface with this probe, and by doing so, we can effect change in both that subcutaneous fat layer as well as in the dermal tissue itself. We deliver a very precise and controlled level of energy that targets a very narrow range of temperatures. And this is adjustable in real time, and we target very precise endpoints to achieve the purpose that we want. At the same time, we have an infrared camera that is monitoring the situation at all times, and it's telling us exactly what the skin surface temperature is so that we never exceed a safe level. Okay, because the surface of the skin actually has a different heat tolerance than the lower layers of the skin, which can take more heat before being, poorly damaged. And so this is the concept behind the ThermiSculpt procedure. And I have a little bit of a video to just illustrate. And we're focusing on the neck and jawline, but actually this procedure can be applied to other body sites as well. And so in this video, you see a procedure I'm doing on the arm of an individual. And I'm going to turn off the music, but I'll just narrate. So basically, the first thing that we do is we numb the area. And this is just a dilute solution of lidocaine that we inject, again, via these very tiny puncture sites. It numbs the area so it's completely non-painful. Then we take the Thermi probe, that's this one here, and we slide it underneath the skin, and it's at the tip of this probe that the radio frequency energy is delivered. After we slide it underneath the skin, we can then monitor in real time the temperature of the skin on the surface via this setup here, which is an infrared camera. And you can see that it's a very minimally invasive, essentially non-scarring procedure that, if done correctly, is virtually entirely painless. And it's a gentle procedure that doesn't require a lot of, loud noises and harsh mechanics. And overall, it can be done in a very smooth and relaxing fashion. If it's even possible to be relaxed during a medical procedure. But most of the time, our patients find this to be a very reasonable procedure to undergo. And like I said, with the proper safeguards in place, it is extremely safe. And although it's not completely non-invasive, because we are entering into the skin via these tiny little puncture sites, it would be something that is very minimally invasive, and the risk versus benefit ratio becomes very high because we can be minimally invasive, but reap the benefit of a more invasive procedure while still minimizing our risk. And so that's kind of the concept behind the Thermi procedure. It isn't a short procedure, okay? It does take time for us to gradually and very purposefully increase the energy levels so that not too much is delivered at one time and the energy is evenly distributed throughout the entire treatment area. And so you may expect to undergo this procedure for an hour or two as we are doing the entire combination. Okay, but that's something that we sort of tune on our end, and most of the time for our patients, they're just kind of laying comfortably there throughout the procedure. Okay, so that's that part. Now, when we do the treatment without or combining it with microliposculpture, we can also achieve some reasonable tightening, okay, especially in individuals who just have skin laxity and they don't have any sort of excess fatty tissue or not much. And as you can see here, it's a nice natural sort of improvement in that under chin area and also in the jawline definition. Now, again, this is a minimally invasive procedure, so it's not a full surgical result, nor would we ever claim that to be the case. But the advantage to a procedure like this is that, again, there's no scarring, minimal sort of healing time or requirement, and that generally doesn't take you out of your life for very long. And you can see that the improvement in that angle. For this individual here with sort of additional concerns in terms of skin quality, also a lesion there, sort of a mole that she doesn't really like, and then some developing skin laxity as well as some excess fatty tissue. In this kind of situation, we would combine the Thermi procedure with like a microlipal procedure, okay, to sculpt the jawline and the submental region, but we'd also do a little minor surgical removal of that mole, for example, and then some laser maybe on the skin to improve the skin quality in terms of its appearance, redness, sun damage, fine lines, wrinkles, and just overall surface quality. And this is all done at the same time, or it can be combined at the same time to save trips to the office to get a synergistic result. And most of our patients opt for that approach. Now, of course, it can be split up if that is the desire. Okay. And sometimes, that's what is preferred. And that's totally fine too. We can also customize a plan where everything is done separately or in parts here and there. Again, the most important thing is communicating, our goals. So we all have a clear understanding of what we're trying to do and what our comfort level is, and what the risks and the benefits are. And that's where the consultation is extremely important to undergo, because that's where truly the plan and all the magic it happens. So this individual here, a little bit of submental excess submental tissue, a little bit of skin laxity, not too far gone by any stretch of the imagination, but still very amenable to some improvements that, with the ThermiSculpt procedure, we can get clear definition of the jawline, complete reduction of the submental area, and just improvement overall skin quality. If we wanted to further sculpt this jawline, for example, we may even consider a little bit of filler to enhance the structure of the jaw. So that's kind of an overview of how we would approach this submental area in the jawline, with the variety of different techniques and technologies that are available to us. And again, it's not necessarily the specific type of brand name technology or the device product that we're using necessarily. It's kind of how we combine them together and how we use them to achieve individual goals, in an aesthetic nature, and a very safe way. So that's kind of our goal at every sort of turn. And when we do a minimally invasive procedure like ThermiSculpt with some micro liposculpture, we have dedicated facilities, a higher standard of operating room, essentially, that built into our office, where we can deliver the optimal level of anesthesia if needed, for example. And we have special staff that are trained in these areas to assist us. And so we take this very seriously. It could be as simple as an in-office, sitting in the chair, some ejection, or a little bit of ultrasound to tighten, or it could be up to and including an appointment in our purpose-built operating rooms to get a more combination procedure. But that's something that we pay very close attention to and tailor for every single one of our patients. So thank you very much for joining, and happy to answer questions or anything that curiosities that have arisen.
Thank you so much, Dr. Wu. That was great. Now is a great time to include your questions in the Q&A box. And while you are doing that, I wanted to let you know that we do have an exciting promotion. So our promotion today is the first 3 attendees to schedule a ThermiSculpt treatment with Dr. Wu will receive 15% off their treatment, plus a complimentary skincare basket. So I will drop a link in the chat now. And you can use this link. It goes directly to booking with Dr. Wu. So make sure you schedule your consultation as soon as possible to be one of the first 3 to get treated. And a little disclaimer, treatment must be completed by the end of December 2025. So make sure you get those consultations in as soon as you can. All right, so moving into the Q&A section, we have one here. Can I get this procedure? Will it be fine for my skin if I use retinol daily?
Yeah, it's a good question. And the short answer is absolutely. There's no conflict, or even necessarily relationship between using a topical retinol and doing a ThermiSculpt procedure. In fact, they're quite complementary. A topical retinol, purpose of which would be for maintenance and prevention, whereas the ThermiSculpt procedure is more transformative. And so we do the ThermiSculpt, and then obviously place high attention on optimizing skincare moving forward so that we can preserve and maintain our results for as long as possible. So there's no danger in combining these 2 treatments together at all.
Awesome. All right. The next one is it looks to work on a specific issue. Will this work for more on laxity in the Plantsman bands?
Yeah, in the sort of like the platysmal bands, for example, is that the question? It's still focusing on the neck area. Yes, it can work well to tighten the entire skin of the neck, with the radio frequency component of the treatment, the thermi component, is one of the more effective ways to tighten the skin of the neck itself.
Awesome.
But if there is significant plasmal banding, so this is in reference to the muscle that kind of bunches sometimes and causes these little vertical bands through the neck, then combining this procedure with a little bit of Botox, this is another ThermiSculpt³ if you will, combination that we do, is very effective. And Botox is approved for this area. It can help to relax that muscle and even lift and sculpt the jawline in combination with this ThermiSculpt procedure.
Awesome. So we have a couple of questions about the healing process and duration. One was more general, one is specifically about if they do both tightening and fat removal.
Yeah. So in general, as a minimally invasive procedure, you can expect to have some visible healing time. And that typically looks as if there may be some bruising in the area for a few days afterwards. Okay. And there is usually some swelling in the areas that have been treated. And I'm referring to the ThermiSculpt procedure with microliposculpture in combination. The thing that we see though sometimes is that the amount of swelling is offset, sometimes to a large degree, offset by the physical reduction of the fatty tissue in the area. So although the skin may be swollen, it may still look a little bit better, immediately after the procedure, disregarding if there are bruises and stuff of that nature. But very shortly after the procedure, you can start to see what the future has in store, essentially. It's not perfect, but you can start to see a more definition to the areas and a reduction of the fatty tissue and even a tightening of the skin, although that sometimes is more due to swelling than any true change at that stage. Um, but I usually tell my patients to expect to have some form of noticeable, healing for about a week or two after the procedure that is not painful, and it doesn't actually bother your life in a functional way. Okay, it may appear as if something has been done to the area, but it's not a functional impairment, and you can still go about with your life, whatever you're comfortable doing, you can do. Um, and that's for the first week or two. And then I usually say by a month from the procedure, you actually can often start to see some improvement already, some real improvement a month after the procedure. But for the final and ultimate goal of tightening and collagen production, that does take more time. And I usually say between 3 to 6 months is the final sort of maturation of the procedure itself.
Great. We just got a question about whether or not you have a before and after image of the arm video you showed.
Oh,
Uh,
that
I think
yeah, on the website I think that patient may be displayed on the website, but if not, then we certainly have arm before and after probably on our website is what I would say. Would you agree, Rob? Is that kind of
Absolutely. So that what depending whether or not we have a before and after image of that patient specifically, we can certainly check, and if we do, we could go ahead and post that to social media on our stories to sort of like recap the webinar. Otherwise, there are plenty of before and after images of arms in the gallery on the CL Derm website. If you go to the homepage and click on photos, you can there are a bunch of different features for filters, and you can filter down to just arms. So I suggest looking there as well. Alrighty. The next one is, can I have ThermiSculpt if I have a pacemaker?
ah, that is a very good question. Um, so the ThermiSculpt procedure relies on radio frequency energy. And how radio frequency works is that it does induce microscopic localized current um, into the tissue that travel through the tissue and get converted into heat due to the resistance that is there to their motion. And so if you have an electrical device implanted in your body with the ThermiSculpt procedure, it scientifically is safe to do, but I would strongly recommend, clearance with a cardiologist, um, to just to double check that your particular situation is suitable for the procedure.
Absolutely. All right. So our next question is, what about age? Who is too old?
Yeah. Actually, age is not necessarily the thing that we look at. It's more the degree of skin laxity. Okay, and that can be genetically, variable. Although in general, the older we get, the more laxity we get. I would say a more accurate way to look at it is if there's too much skin laxity, okay, then the procedure is not dangerous and it still will give you some benefit. But in those situations, we find that the benefit procedure might not be enough to be fully satisfactory, um, in which case, a surgical approach may be the better option. However, if a surgical approach is really not what you want, okay, as for your own personal reasons, you just don't want to consider that option, then there are still further combination treatments that we can do, including the ThermiSculpt procedure, but we stack that with other more sort of skin tightening procedures like the energy-based devices, and we do them in a more aggressive way to try and get as much result as possible. So it's still doable, okay, but we would have that conversation about, would you want to consider a surgical option instead, and the pros and cons of that. It's just a little bit of a more nuanced discussion.
Awesome. So we just got a question, how do we schedule a time not available on the link? So when you click on the link, it'll bring up Dr. Wu's online scheduling, and you can click on the green link within the scheduling option that says first available Tuesday, December 2nd at 8:30 a.m. So there are dates available. It's just showing today's date, so there won't be any availability today. So click on the Tuesday, December 2nd at 8:30 to get to the area where there are available dates to schedule. Right. So we have another question here. We have a lot of cost questions today. So at Cosmetic Laser Dermatology, all of our treatments are highly customized. So we can't give you an exact cost, but we suggest coming in for that consultation where your dermatologist will give you an exact quote for you. Okay, so the next question, can your neck have too much lax skin to see results?
Yeah, yeah, that kind of speaks to the question that we were just discussing. It is possible that the skin is too lax, and therefore the degree of improvement, even the maximum degree of improvement that can be achieved with this procedure, might not get to your goal, whatever that may be. Okay, and so that's a discussion that we have to just honestly have in the office during the consult, which is, another very important reason why the consult is critical to all of our procedures.
Absolutely. All right. And next up is, can brown spots be treated at the same time?
Absolutely. We stack lasers on top of this procedure all the time. And there's some practical benefit because it's already numb from the procedure itself. And so when we do the laser on top of it, you don't feel anything. And it works extremely well.
Awesome. So we have a couple of questions that are addressing specific issues, like what combination of treatment would work best for a saggy jawline and marionette lines?
Mhm.
Uh, and then another one is asking if your issue is mostly jowls starting, like beginning lag, pouch mid jawline, and neck beginning to become loose, less fat, more sagging skin with jowls. What are the best treatments? And can ThermiSculpt
Yeah.
address
You know,
that?
in general, I can say things like, if you've got some excess jowling and some excess fatty tissue here, then a Thermi plus microlipo might be a very good option for you because it'll also tighten the skin a bit. And in general, if you have more skin laxity than fatty tissue, then we can consider things like the non-invasive skin tightening methods, plus or minus a Thermi procedure. But again, this is where um, every individual person, we really have to look and thoroughly examine the areas of concern in order for us to really zoom in on the best treatment technique and technology and combination of treatments that will get us to the goal, in the most cost-effective way, in the safest way, and in the most effective way as well. So unfortunately, beyond general sort of recommendations, there's not much I can say unless we're, face to face and talking about the issues.
Absolutely. All right. A couple of people are asking how long do the results last for ThermiSculpt?
That's a really good question. And the interesting answer is that in the situations where we're removing fat as a primary feature of the treatment, okay, that is a very long-lasting result because once fat is removed from the body, it tends not to, like physically removed, tends not to come back, assuming that, our weight is roughly the same. Okay, not huge amounts of weight gain or weight loss either way. Um, in terms of the skin tightening effect, again, it's a little bit difficult to measure the exact longevity of this because we stimulate new collagen growth, and that new collagen is going to be with us for a long period of time, but it slowly breaks down too over time because of again genetics and environmental influences, etc. And so for a purely skin tightening procedure, I often recommend maybe considering a yearly sort of treatment for maintenance purposes. Okay. And so I have many patients who maybe undergo one ThermiSculpt triple combination, um, for the first time, and then subsequent to that, might do a yearly minimally invasive skin tightening procedure just to maintain over time. And that may be combined plus or minus with a little bit of laser once in a while to also improve the skin quality. So that's kind of how we would approach, conceptually these types of situations in terms of how long a procedure lasts. Um, and as long as we kind of understand what the goals are and what you want, and we can usually design a plan to sort of meet those goals and those needs.
Great. So we just have a couple of questions left. Can you tighten skin in multiple areas, for example, neck and thighs in the same procedure?
Yes. Yeah, absolutely. Areas that are not connected to each other can be done at the same time or separately. And there's some benefit to doing it at the same time because it's just, again, one visit to the office. If we're doing it in the OR, there's an OR fee as well. And so that can be all rolled up into one. So again, it's personal preference. And we just give you the information that you need to make your decision.
Awesome. All right. And last question regarding arms, does this reduce cellulite appearance?
Mm. Cellulite, tricky. I wouldn't tout this necessarily as a cellulite specific treatment modality. If in the process of treating your skin laxity and maybe sculpting the fat a little bit, we get improvements in your cellulite, that I have seen certainly. But the primary goal is to tighten the skin and to sculpt the contour and the fat. Um, and that's not necessarily the same thing as treating cellulite. So I wouldn't recommend this treatment purely for cellulite reduction purposes.
Gotcha. Oh, it looks like just one more came in. Do you do above the knees?
Yes, the knee area can definitely be treated. And there are many options for treating like loose knee skin or elbow skin, for example, Thermi being one potential option, but there are other options as well, depending again on the clinical situation.
Awesome. Well, thank you so much, everybody, for coming. And Dr. Wu, thank you so much. This was a great presentation. Remember, everybody, next steps are scheduling a consultation with Dr. Wu using the link I used in the chat, or you can go to the CL Derm website and book directly through the website itself. So make sure that's your next step this evening, and we will see you in the office.
Thank you very much. Okay.
Great. Thank you,
Have a great
everybody.
evening. Thank you.